Hi there. I want to talk about dementia care, and because I'm so emotionally distraught in regards to the care my parents are receiving. And it kind of feels like if you've ever had a dream where you're screaming in your dream, yet no one can hear the scream, and you just can't get it out. That's exactly how I've been feeling lately. Well, for a long time, actually. And so I thought I'd post a video about how I'm feeling because I know some of you are feeling the same way, and maybe we can help and work together to promote some change. So, in regards to my parents, I feel that um, people working with them, people making decisions on behalf of them, and this includes healthcare providers, are making decisions, not getting to know my parents at all, and not seeing them as an individual person, and and that's where I think care should begin, is seeing them as people and not just dementia. There's this someone wrote and said, if you know one person who has dementia, well, then you know one person that has dementia. Everyone is different, and just as we are all different, and the care can't be the same for everyone. It has to be person centered and strength based, and not just dealing around the clinical aspects, and not just making decisions, just grouping everyone in the same care model, because people are individuals, and what works for one person doesn't work for another. And you can't sit in an office and make decisions about my parents without getting to know my parents. And in some cases, decisions are being made, and the people making the decisions have never even met my parents. Yet they know what's best for my parents. And I just find this so ridiculous. Um, so I'm really advocating for person centered dementia care, and education and training. I do think people who are working with dementia patients, they are doing the best that they can with the support they have been given. I don't think there's anyone out there who doesn't want to do the right thing. And I see, and I've met so many caring people that have worked with my parents, and but they don't. I think their education is limited on how they need to perhaps implement the best care and reduce behaviors, and ensure that they are receiving adequate um, activities to do. And that's a huge thing. Everyone needs to be around people, engaged with others, doing things that they enjoy, not just being told this is what you're going to do now and this is what you're going to eat now. I mean, there has to be some choice. Everyone likes choice in their life, including people who have dementia. It's no different. So I also think there needs to be a more inclusive model in healthcare settings. For example, my parents are eat in a room, one dining room, but there's a couple more in the building, and there's one huge dining room. But my parents, because my mom's technically in assisted living, is not able to join others in that large dining room. So my parents have to sit in a room. They're very verbal. They love to engage with others, although they need help getting there, like actually initiating the engagement with others. But once they're in front of somebody, they love to talk, and they love to share stories, and they love to listen to stories. Yet where they're sitting, No one's engaging in any conversation. I was again just there a couple days ago, and the place is silent. No one's talking. So these people need to be sitting with people who can engage in a conversation, even if they're just listening to others speak. That is so important, and that may help them feel somewhat included and have some value in their life. So, and there's no reason why the people in that dining room, based on what I've seen, um, can't be sitting with other people in the building. So that's that. I think that's a small step in the right direction, and and I know that there's places out there that are trying to be more inclusive, but I really do think it needs to, grow, and needs to be seen in more and more places. I've, I've also seen in um, a hospital, um, where my mom was there getting treated for an infection, but on the ward that she was on, there were obviously several people with dementia, and she had to return to the hospital over a period of several months. And some of those people were there for months. Um, so these dementia patients would just wander the halls. They were in a locked facility and with no engagement whatsoever. Nothing to do. Nothing, 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 nothing. And I just found it so sad. Like, and also it's such a clinical environment. Sure, it's a hospital, but if you have people who have dementia in it, then there's so many examples online actually, but of just a can of paint and painting some things on a wall and making it look more homey can could make the world of difference to these people. Setting up activities that do not require a lot of like a huge dollar amount. They can It's just stuff from home, and I'll try to list some of those activities as well. If those people were engaged doing something, um, they would be much happier and much more engaged. And it's terrible to see how some people are being treated, and it's certainly not strength based. You need to get to know a person and what they like, what they've done in the past, and try to have them continue those same activities, um, and just don't shut them away somewhere. Um, it's cruel, and I think we can all do a better job. Our population is aging. We're going to have more and more people with dementia, and we need to do better. We have to do better. And that comes with education for families, personal directives, healthcare, um, people, hospitals. Um, there's a lot of work that needs to be done. And I think there's some good examples, and we need to build on those good examples. Um, the butterfly model is a great example of things that can be done, and just the whole approach that should be implemented for people with dementia. It's an excellent model, and I'll share a couple websites that talk about it. So I think we should all, advocate for our loved ones, and even for ourselves. Who knows if we're going to have it in the future? But um, the butterfly model is very person centered and and just emotion centered. So I really encourage you to check that out. Also, there's great videos by a doctor online, a psychiatrist who deals with people with dementia and works with families whose loved ones have dementia. And that is Careblazers, Dementia Care Heroes. And I will post that um, address as well that you can look up. She shares some excellent videos with some excellent advice, and it's very positive and strength based. And so that's where I think we should be going. Even, do people always have to wear uniforms in some of these places? I mean, that makes it, again, be so clinical. Um, so, just a few examples of change that we can do. But also, I want to just put it out there that I'm hoping that you will share this with companies who advertise on television or on the internet. I'm going to be doing the same, or at least even getting a hold of someone. Um, and if they advertise, then asking them if a small, very small portion of their, of their profits or advertising dollars could go towards educating others about dementia, and best care, best practice approaches. Um, so if they could be a part of this change, whether it be just donating dollars so that, let's say, the Alzheimer's Society could help educate others, but or even within their commercial, just taking a few seconds to advertise really good dementia care. Um, I don't know. It's just a small start. Um, I'm sure people have better suggestions, more suggestions, but I'm just hoping we can all at least um, strive towards change and better support for people. So thanks for listening. Thanks for listening to my rant, and take care.